morning, friends. It's a delight to be here in the presence of multidisciplinary experts in various fields to see how we can converge into something that is rather urgent in our country, which is healthcare. There is a time in the evolution of any discipline, any domain, a period which later on will be classified as a turning point. Healthcare has had many such turning points. The discovery of penicillin, the eradication of smallpox, so on and so forth. And these turning points are always highlighted with a trajectory change that is towards the betterment of society. Today, healthcare is in one such phase, I believe, where the old is giving way to the new. The traditional is making way for the modern, and the entire profile of health is changing like never before. We can call this disruption, we can call this metamorphosis, or we can call this transformation. It doesn't matter how we call it, but it will certainly be a milestone which our coming generation will remember. And I say this because never before has there been a confluence of so much of knowledge, skill, technology, innovation, and resources, as Madam mentioned, as we have today. And therefore, this churning is of great significance as medical, nursing, biotech, research, scientists, software professionals, venture capitalists, they all brainstorm together, and this is one such meeting, to carve the way forward for healthcare in this new millennium. Can we imagine our lives today without the following? The cell phone. Even when we are asked to switch it off, it just goes automatically. Not a minute without that. The internet, Google Pay, Google Maps, YouTube, Swiggy, Spotify, and 100 other things that enhance the quality of our lives. Can we imagine without these? No. Can we imagine healthcare without the glucometer? Now the continuous blood sugar monitor, the oximeter during the COVID period, precision imaging that has transformed imaging diagnosis, bedside ultrasound which has replaced the stethoscope, endoscopy, nanomedicine, capsule endoscopy, and EMR. We cannot. We have therefore today successfully transitioned from the infirmary age of the 1900s, where there was just a room such as this with 40 beds, nurses, with some powdered medicines compounded by the compounder, doctor's visits, and nothing else. We saw ourselves transitioning at the millennial change into the intensive care age. And if we walk into any standard ICU, the patient will be hooked on to 10 or 15 monitors and IV drips, which helps this very sick patient to have a chance of living once again. To today, 25 years later, we have entered the algorithmic age, challenged by a new form of intelligence that is equal to, if not surpasses, the human capacity. So the future is really very bright. In the last 4 years, nudged by ChatGPT, the deluge of digital applications, gadgetry, and artificial intelligence has brought us to this new threshold of opportunities. In the immediate, more than immediate, in the intermediate and distant future. And what we are witnessing today, what we may be a part of, It's actually work in progress at different scales, but it's enlarging at an exponential rate, and sometimes it frightens as to where we are heading. In clinical medicine, the eye knife in the hands of a surgeon, which can obviate the need for tissue diagnosis, frozen section, where he can make or mark the edges of a tumor that he's cutting. The e-netra, which is another device that helps a common man to just fix it onto his cell phone and do refraction himself to see whether he needs glasses. And of course, the bionic hand, which many of us have not seen. I'll show you a video now. This video, which is representative of anecdotal brilliance, is a metaphor for what lies ahead in healthcare that brings hope to even those who have no limbs to move, but have the hope now of leading a normal life. I'll just play that video, please.
So honoured to be here today. Thank you so much for inviting me. I had a severe disease when I was 15 months old called meningitis septicemia, and they basically said that I was 100% going to die, but somehow I pulled through and I'm here today. Well, since losing my hands, I lost them so young, and I can't remember ever having hands, but I always wanted them. So ever since then, I've been working with all kinds of tech companies trying to help develop bionic hands for people like me. These are from a company I'm working with currently called Open Bionics, and then we're trying to stray away from trying to blend in. We want to embrace the fact that we're unique. We don't mind being different. The hands I've had in the past were made to be really realistic.
Oh, can you give His Holiness a hand? Whoa! Quite so.
Very inspiring indeed. That gives a lot of hope to this young lady now, who's going around the world showing what technology is capable of. There are a zillion healthcare apps available in the world today, which can be accessed. In 2019, there were already about 23,000 healthcare apps, fitness apps that were available for here. So, ladies and gentlemen, technology is here to stay. Today, I saw a couple of days ago a small internet post that talked about an AI doctor-less chamber in Malleswaram in Bangalore. I don't know how many of you saw it. Apparently, it's very popular in the United States, where you can go in and it will give you 192 blood test results without a drop of blood. And it will give you various other parameters for you without the doctor. And of course, it will get relayed to the dashboard of a doctor sitting remotely, and many amazing things can be done. Likewise, there is a pendant which is AI supported that will do the same thing. It has not yet come to India. We have met this morning to discuss this panel, which is about two words: Smart Hospitals 2035. And I'm very glad that we are discussing this in the holy sanctuary, the Sanctum Sanctorum of Science, not Commerce. And with the hopefully collective primary commitment to what is most important for us, and that is the patient. The acronym for SMART can be described as specific, measurable, achievable, relevant, and time-bound. But there's another connotation to it, which I would put it as efficient, effective, cost-effective, enduring, endearing, and empathetic. Because the success of a smart hospital lies not only in technical brilliance, but in making it available and cost effective to the last, the lost, and the least. There's a difference between smart hospital and smart healthcare. They are not synonymous. I wear a hat of public health, more public health, after 40 years of cutting-edge technology-based cardiology practice. As I see this hinterland of India, I'm convinced like never before that if technology has to penetrate to the last spots of our nation, it has to be bottoms up and not prescriptive as it's turning out today. Healthcare enshrines a host of social, economic, ethnic, geographical, and political divides in our country. And therefore, the scale and scope of a smart blanket is just too enormous for any meaningful transformation to happen by 2035. I will reserve the rest of the discussion for the panel, but let me just give an abstract of what I consider are our strengths today for 2035, 10 years from now. Our strengths are really, as ma'am mentioned, world-class clinical acumen, which takes the best doctors and creates the best doctors from India all over the world. Clinical acumen, manual skills, the best surgeons that you can find are from our nation. Technological and now AI acumen. Integrating AI, machine learning, and blockchain into predictive diagnosis, precision imaging, and personalized care planning is definitely the three roads that I can see for 2035. We may have hospitals that will allow sensors to integrate into our hospital system so that all aspects of care would be taken care of. Let me end by just saying that smartness will be achieved from all the brilliance that we have from 5 ways. That ultimately smart hospitals must be part of an ecosystem of smart healthcare, which will have 5 ways: available, accessible, affordable, appropriate, and affable. It's only then that our dreams for what we want for this nation will be fulfilled. Thank you.
Ladies and gentlemen, may I also invite on stage Dr. Major Sandeep Kumar, Mr. Bharat Gera, and Dr. Amit K. Jotwani. And those beeps are not for any reminder. Please be seated, sir. Just to introduce Dr. Chandy, a distinguished cardiologist, healthcare visionary, and formerly the director of CMC Vellore, and now the chief medical officer of ITC Healthcare. He is widely respected for advancing ethical, patient-centric, and tech-enabled healthcare across India. Please be seated, sir. As the speaker for the next session, this is first panel discussion. Get seated. Let me also introduce Dr. Major Sandeep Kumar, lead clinical scientist at Entrance, a former army doctor. He brings together AFMC and IIT Delhi expertise to pioneer AI-driven healthcare for underserved populations. Mr. Bharat Gera, a stalwart of India's digital health movement and founder of human-centric healthcare ecosystem, formerly CEO at major hospitals, is known for combining technology with empathy in care transformation. The panel will be moderated by Dr. Amit K. Jotwani, co-founder and CMO of Onco.com, one of India's top clinical tech startups in oncology. A seasoned radiation oncologist, Dr. Jotwani bridges clinical insight with digital innovation in cancer care. Let's now dive into hospitals of the future, what it should truly look like: smart, ethical, inclusive, and human-centered. Another request to the moderator of all the sessions, not just this session, is that we have a 30-minute session that is there, excluding the keynote, because many of the speakers have flights to catch after that. So I request all the other panel moderators also to take care of it. Over to you, Dr. Amit.
So, very good morning to everyone, and it's a very important topic for the start, and we have stalwarts to talk about it. Okay, so before I start, I'll just narrate one incident that happened. It would give us a good start to the discussion. I went to see one of my friend's father who underwent a knee transplant, knee replacement surgery, and when he's 76-year-old retired government employee, and I was sitting with him, seeing him, he was on the bed, and there was a wire coming out below his mattress, bed mattress. So I was just looking at it, just noticed it, and I didn't say anything. I noticed, and I thought some sensor would be there. And he noticed, the patient noticed it, okay, I'm looking at that wire. He says, Dr. Amit, what is this? I said, maybe some sensor, I said. So I didn't think of discussing more. He says, no, this is a sensor. It monitors the 76-year-old retired government employee, not a doctor. Gentleman says, it monitors my breathing, it monitors my BP, it monitors my heart rate. And you know what? Something happens to me, this relays outside to the nursing station and they would rush in. And then in Telugu he says, Chala smart kada. So that is what the people have already started noticing. This is an endorsement of technology creating value and people noticing it. So with that, I would like to ask our panelists, what is their understanding or their point of view on the concept of smart hospital? So Dr. Sunil would like to.
Thank you. That was an amazing story. Now, I just want to remind ourselves that, about 10 years ago, there was a smart city movement in India. 100 smart cities. Mysore was one of them. Indore was one of them. I wonder, and I ask myself this question, is there any smart city existing today? What happened? So there's a learning here that, just by the definition of smartness, if I remember that, was that we will have at the bus stand, there'll be 30 cameras and that will track this, and there'll be, monitors, and you can see yourself the 100 things which were all digital. Unfortunately, it did not live up to it because of various reasons. And personally, I take a cue from that learning experience that smartness is not about putting the best gadgets in the system. Smartness is about, as I said, making it available. If you really want a true healthcare transformation, it will reach the hands of a man who is not literate, whose hands are soiled because he's a rural farmer, and who can afford. How do we do this in the hospital healthcare scenario? I do not know. But I think we should learn from that failed experiment of smart cities to understand that there are very basic essentials of life, basic essentials of care today are gaping at us like huge gaps in the system. On a crowded road in Bangalore, if you have a heart attack, which digital technology will transport you, across 45 minutes? None. So we have to evolve and rethink how do we make healthcare, not just hospitals, into smart. Because it's ultimately the man on the road who should be benefited. Today, technology is very provider-facing. And I am making this humble appeal, wearing the hat of a public health person now, to make it patient-facing. And when you say patient, the prototype of that person must be the rural farmer in Jharkhand who has no money, is not savvy with kiosks, can't handle a cell phone because the cell phone screen will be soiled with mud and has no money. I have not given the full answer, but I'm raising more questions, which these are questions in my mind as to how do we tweak bottoms up, that we start with the questions that tell me patient, what is it that will make your healthcare accessible, affordable, appropriate for you? Not the bucket variety that we have, that you do lots of tests and we'll pick up something and we'll treat you for that. And should he need healthcare again, it should not frighten him. Today, hospitals are morbid, frightening areas because of money. And insurance has not penetrated more than 12 to 15%. Let's be honest. The data will say 45% coverage. That's not true. So that's the question that we need to address. And I'm saying this conscious that you are the brains who can do it. But the approach today is top down and it should be bottoms up for us to make, into which research will come into the big play. And I hope that your hospital will be, transformative in this unique journey that has started. Thank you.
Yeah, thank you. So I'm just going to take off from what you said. I just did a crowdsourcing poll on this question. Of course, it doesn't come from the rural farmer, but people on LinkedIn. About 90 people responded, and the question I asked was, which of these four things the smart hospital should be able to address? And these four problem statements, while working with a company which was in patient experience for 200 plus hospitals, almost all the places these four problems came up about all hospitals. So one is, as you all know, why don't we go to the hospital? Because it's going to take half a day. So the waiting time in OPD is one of the biggest deterrents for people approaching hospitals in India. Most often complain that. The other, unfortunately, if you get admitted, one of the worst parts about a hospital experience is that after you're discharged, you're going to wait there for 5 to 6 hours before you get out of the hospital. So that's a very common complaint. The third very common complaint is that I rang the bell, the nurse took too long to come. And we have the best nurses in the world, but we don't have enough trained ones. And they're burdened with too many tasks to do. And very often the complaint from patients is that nurse didn't come on time for my, changing my battery, putting my IV line or whatever, right? Or monitoring my BP and monitoring my that the solution that you're talking about address that problem. And the fourth one was something that very few people talk about, but we all experience. A lot of people go to hospitals and they say, after waiting for 2.5 hours, I got 5 minutes or 4 minutes with the doctor. The doctor wasn't even looking at me. The doctor wasn't even talking to me, and it was a very bad experience, right? And I said, okay, should the smart hospital be able to solve these four problems, and which one should it give the highest priority, right? So, any guesses which one was the highest priority? And all of you who feel discharge time was the highest priority, or the waiting time in the OPD was the highest priority? Please raise your hands. Okay. Well, the surprising answer was the clinician-patient engagement. 46% of the people said this was the biggest problem. So you're going there for the highest value that is going to come to you is going to be your engagement with the clinician, right? And clinicians are if you read the book Theory of Constraints, the biggest constraint in a hospital today is what? Anybody with real estate can put up a building, buy the equipment, and create the front office and everything, right? What is the limiting resource in getting a world-class hospital to run? The right clinical workforce, right? And that's very highly limited. And I don't think we are doing enough to help this clinical workforce perform better. Unfortunately, when I ask hospitals how much are you willing to invest in technology, the budgets are well below 1% of their turnover, right? I think 50-bed hospitals, I was asked to do a review of the Ernst & Young study on how much they're willing to spend on technology. It's below 5 lakhs a year. For the software, they want to spend something like 20,000 rupees a month. Right? 20,000 rupees, you're going to make a hospital smart with that kind of expense. That's the money you probably have to pay a minimum wage to pay one housekeeping workforce. So I think the smart technology is there out there, but I don't think we are identifying the right problems to solve. I've not seen enough going into clinician engagement as a problem to be solved, how to make it more productive. And I say human-centric because it's not just patient-centric. Today's doctors are really bewildered with the kind of questions that come from people reading up stuff on ChatGPT and coming to them. They have to spend inordinately amounts of time to explain people these things when they come and answer those questions. They are burdened with looking at mobile phones of patients to see the lab data because, like you were saying, no printout. Printout has been done away because we've become smart. We have the patient's mobile phone. I think to become smart by 2035, we have to think in terms of a platform-centric approach, where a platform makes all hospitals smart. And I think the Ayushman Bharat Digital Mission is targeted towards doing that. And by 2035, I'm sure by 2030 itself, we'll achieve that. The initiative that's going on right now. Thank you.
So, adding to what you said, the patient is the most important stakeholder. We start from there.
I think the human interaction between the patient and the clinical team, that part is the most important aspect of healthcare. Unfortunately, people pay too much attention to the building and the equipment. Whereas, like you said, healthcare gets smarter and smarter. It's all going to be about the engagement between the people who are the care providers and the patients and their families.
So this is like iconic quadruple M. It used to be triple M, then became quadruple M. All that very important part of it is patient experience. The whole journey experience of patient, right from registration to completing the treatment follow-up and all, then improving health and also. Sandeep, you come from background of both in medical side and now into technology. How do you address when you think of concept of a smart hospital? How do you address these aims?
So thank you, sir. So basically, if we look at hospitals and any kind of interaction which patients have in the hospital, so the interaction is between patients and trained staff. So you can think of it as specialists, trained nurses, trained paramedical staff, and then the administrative staff. So as I talked about the theory of constraints, these are the hardest constraints in a healthcare. For example, if a hospital just has, say, 5 endocrinologists, everybody only has 24 hours even if they give their max. So the time is a big constraint if we see in healthcare. Similarly, if we look at the availability of physical infrastructure, so physical infrastructure as in the medical devices, plus the availability of equipped beds, these are the limitations which we have in healthcare. So smart hospitals are going to target things like this. So the resources which are already in very limited availability. So it doesn't make sense that if a doctor already has 24 hours, how is technology going to increase that? But we could use proxies and circuits, which could, so technology could be a good proxy for that. So rather than starting a patient-doctor interaction the moment when the patient walks in the hospital, we could increase our time when we start interacting with the patient. So through using like technologies which have so if doctors have a certain kind of video platforms where they pre-explain and re-educate patients with their conditions, so that also adds to adding to the trust of the patient. They know about their condition from the doctor who is going to treat them. So these are the few things I think where the technology is going to help. Plus coming to the in-hospital processes, so the trained staff they have to carry out certain procedures, they have to take certain decisions. So technologies such as AI, they are going to reduce the time taken to the decisions and to carry out those procedures. So I think given the limited resources, the smart hospitals, it is going to increase our efficiency, and within the limited availability, how much more can we do out of it? I think that is going to be the aim of smart hospitals, and that is where we are going to come at.
So whenever we talk about digital transformation, we talk about value creation through digital means, patient experience, improving other things. One question always comes. We also struggled while we co-founded. When we were running Onco.com, we offered on integrated human board services to hospitals. That all their doctors could see the patient details, files and all before coming for the meeting. They would make their mind, they would study if there is any literature review they need. The question comes, who will pay for the technology? Where will that money come from? Because already hospitals are always complaining about cost and infrastructure escalations, manpower cost escalation. Hospital is one industry where you need 3-shift quality skilled manpower requirement. Other industries you do 1 or 2 shifts. Hospital require 24-hour coverage from skilled manpower on infrastructure, everything has to function at that time. So how do you address the cost challenges? One of the aim when we struggle, when we talk about value creation in healthcare, improving healthcare is cost reduction. So how do you see smart hospital concept reducing it, and who will pay for it? You can take that.
So how I would think of it as, so for example, looking at the AI models, we see that the models are getting more and more efficient day by day and leading to the commoditization of the AI models. So once these are commoditized, so that would lead to a reduction in the cost of using those models. And the second thing is the pressures, the economic pressures. I would say that once patients see value in better healthcare, they would be willing to expand their limits and be willing to pay more. So I think that would balance it out. That's my
Yeah, the problem is very real. The capacity of the average person to pay for healthcare is it's not affordable for a lot of people. I have seen my driver go through an accident having to spend a couple of lakhs. I've seen another one who's in the ICU right now with a bill of 8 lakhs. And today's aspirational class, even with low income, comparatively low income, wants to spend money on the best care. Everybody wants the best care, and the costs are very high. And if you add another line item to it saying, like the Swiggy guys add the delivery fee and the platform fee, now what if the hospital starts adding another 1% or 2% as platform fee for curing you? That's going to be tough. But then again, the one you started with, if the patient themselves can see what is the value coming in, and like you rightly said, Dr. Sandeep, if the patient themselves see the value, in fact, the remote monitoring devices that you spoke about, I think I've read some studies about it which said that the prime benefit hasn't been so much in terms of improving clinical care, but it has been about more giving assurance to the patient that you're being cared. So I think a lot of it is about what we can do to improve the value perceived by the I know it's consumer thinking, but it is there.
So that takes us to the next part of the next question around. ENY did a study and they made the statement that patients expect anytime, anywhere, personalized and affordable healthcare services. Anytime, anywhere, whenever they need, whenever they want. That sense of safety they need. That they need sense of being ensured that they will be taken care of if something goes wrong. Or if there is something going wrong, they will be knowing it before. They want to participate. Now, the current traditional healthcare has been that patients actively don't participate. The system, the medical science and all is opaque for them. They measure only what they know. Like I see only what mine knows. So they measure the length of stitches, number of stitches. They measure in how much time the nurse is coming or how fast things are happening. But now they want to get involved. That's where the technology can create a lot of value when we make them part of the decision, the whole process of healthcare been provided to them. So any examples you would give or any experiences you have?
So I just want to say one short story. This is about 10 years back when I was still in clinical practice. There was a farmer in Tamil Nadu. He had consumed about 15 ml of some cow milk, rat poison, because the monsoon had failed and he decided to end his life. He came to casualty and he was picked up in a hospital. He never asked about whether they can afford it or not. He was put into the ICU and he stayed there for 28 days of top class care. He survived, but he was a shadow of his own self. He had lost almost 15 kilos and he could barely stand. A lot of the charges were written off by the hospital, knowing that he's from the lowest socioeconomic, but still, consumables and drugs that we can't concess added up to 1.78 lakhs. And that bill was given to him. And you know what he said? He saw it and he said in Tamil, Dr. Saab, can you just buy me that bottle which I consumed? It is because I could not afford food that I took that. And now you treated me, what do I do? So this is the metaphor of our 70% of our people in our country. And we cannot escape this reality. And therefore, in our delivery of care, not many doctors may be here. I feel there are three things that must be curtailed. Overdiagnosis, over-investigation, and over-treatment. The kind of files that come to me in my company of an executive medical checkup, believe me, 70% of the tests ordered are not needed. Now, he can afford it because the company pays. What about the poor man on the road? And based on that, a stone will be found in the gallbladder. And there will be somebody who will say, usko nikal do. Over treatment. Scans that are done, 9,000, 12,000. So I'm saying exchange this over treatment attitude for good technology, which is transformative. Bring in those and see from our conscience, what is it? That's what I meant by saying appropriate care. If you don't need it, I don't ask for it. And that's where clinical acumen will come in, which is shrinking, sadly. Because today we have a spoon-feeding system that everything AI will tell you. Diagnosis, what is to be done, how is to be treated. And our brains will shrink. So we must put guardrails on this deformation that's taking place. Exchange good technology for this over syndrome, hyped up overdoing syndrome, which is partly commercial, partly because we don't know the diagnosis. When I don't know the diagnosis, I will order every investigation to catch the problem. It's like casting a big net in the water to catch all the fish, and then you leave off the ones you are not interested in. Wrong approach. That's the way we can economize on this. Believe me, no monetization has been done for nearly $3 trillion that's gone into AI. But there's no free lunch. Friends, it will get kicked in. And when it gets kicked in, our healthcare costs are going to be 3x. And India cannot afford it. 60 million people are pushed below poverty line because of current healthcare costs. Government of India is with us. So we have to be conscious that we are in the business of altruistic benefit to our fellow brothers and sisters on either side. That's my angle.
I totally agree with Dr. Chandy. I think consumerization, and that's where a lot of people who came into health tech from the e-commerce world got it completely wrong, because the important thing of creating trust was lost by many of these companies that came into this field. Consumerization is not the answer to solve problems in healthcare. And although I mentioned that you should do what the patient perceives, but the patient doesn't have the right information to deal with. But I disagree with Dr. Chandy on this, that AI is not going to solve problems. I strongly believe that technology applied to the right problems in the right way will solve problems. And I'll give you a couple of examples where it does. So in rural healthcare, for example, there's a company called, forget about naming it. There's a rural teleclinic company which has about 1,500 teleclinics in North India. And the way they solve the problem of primary healthcare, so to say, is by connecting the rural health worker, who could be an Ayurvedic doctor or a doctor with pharmacy background or something, to an MBBS or a specialist doctor in the city using telemedicine consultation, which happens between the last mile health worker and the specialist doctor. This solves many difficult problems where the patient, there are a number of use cases. One was a child who fell down from a first floor and then hurt his head. This problem could be solved without going to the hospital far away and getting scans done and getting surgeries done and so on. The specialist was able to the 10-year-old boy, the specialist was able to diagnose remotely and give medication and said, you wait for 2 days. If you're all right, then you don't need to go to a scan facility. And some problems definitely with ultrasounds being available, point of care ultrasounds being available at remote locations. So these companies apply these technologies, digital stethoscopes, telemedicine, only teleconsultation, which was done wrong by a lot of people, which is just a doctor video conferencing with a patient or a healthcare worker. It has to be with the right point of care technologies available at the other end, and I see huge potential for that to solve a lot of problems across India. And consumerization itself is a bad thing, but consumers being more participative, like you said, is a very good thing. And with AI, again, with ChatGPT, you get so many answers before you go to the doctor, before you you choose a treatment option. I think the consumers are getting more educated, they're getting more aware, and they're going to come up with the right questions to get their treatments in the future. So I think technology has a big role, but it's being mismanaged right now. It's being not applied to the right problems.
I'll just correct myself if I give the impression that AI is not going to help. Certainly it will help in a big way, and as we go into the future, more and more assistance will come. But there are many such initiatives that are making a huge difference in rural healthcare. Even my company uses AI, and it makes a tremendous difference. The key is this: it is not, like we all like to believe, it is not replacing the people who are in intermediaries. There is a health aide who is translating it. There's a doctor, there's a nurse. So this message that we still need human intelligence who have got the right mindset to be kind and empathetic and interpret this complex language at the moment of AI to the last mile is where it will succeed. But we should not get hyped up that tomorrow, doctors are not. I've seen lots of posts that say doctors not needed. The example that I quoted: walk into a chamber, 192 tests. That fellow did not even ask for a test, but 192 tests is there on the menu card. This is a wrong message, which is self-defeating for the technology.
So my hope on that is that smart hospital will be when the people, the human beings are smarter.
Yeah.
The doctors, the nurses, the patient and their family. The more smarter they get with the use of technology, then we have a smart health.
Assisted by it.
Once we democratize the processes of healthcare, once we bring in a lot of level playing field, bring patient also to a certain level of understanding of their health. That's where when you remove obesity, when you bring in more transparency using technology, it's not like there's no transparency, the scope of transparency is very less. You can't keep educating every patient. That would spend hours and hours. So when you bring in technology, there's always that low-hanging fruit, some evolving patients, some evolving individuals to pick it up. But coming back to the concept of smart hospitals, there are a tremendous amount of examples. One was that 5G equipped ambulance. So point of care, emergency situation, golden hour management. That's where the real value a lot of times is already been created in our country itself. So forget about AI and all that would create a more long-term value maybe because we need a lot of data to consume. for AI to consume and come up with these things. But other than AI, there is a lot of work happening. 5G ambulances are there, wearable devices are there. Like as you mentioned, continuous sugar monitoring. So long run, you get a lot of insights from that continuous monitoring. A golden hour from ambulance. There's any other examples you'd like to add, Dr. Sandeep?
So yeah, I totally agree with. So, for example, healthcare is a trust business. So people don't want to talk to an AI bot and do whatever it wants to say. People go to a hospital and they take whatever medicines or whatever treatment is prescribed because they trust the doctors and their experience and the time that they have spent. So that's true. Like, AI is not going to solve all the problems. What we see today is like startups are taking a problem, getting an API and then throwing the problem at it and then trying to solve the problem somehow. But that's a very brute force approach and not every problem can be solved by AI. I totally agree with that. There will be certain problems. So for example, if you are sitting in, let's say, Chennai and your relative is admitted in Bangalore and you're not able to talk to them, these kind of problems are not in the domain of AI. You need digital infrastructures from the hospitals and at a central level. So, for example, what ABDM is doing, we can have access to data at any point of time, like at any location. So, these are the kind of technologies which I feel are going to impact. The other one being is the wearables. So, just like I said, healthcare should not start when the patient walks into a hospital. It should begin when he's healthy and we keep monitoring the health of the patient before the disease actually begins. And we should have a preventive focus towards healthcare rather than reactive when the disease starts happening and it is at an advanced stage.
Interesting. I was in a brainstorming session about diabetes research in India, and there was a doctor from Harvard, and I asked him, when should we begin the monitoring of the patient to prevent diabetes? And the answer was surprising. It's teenage. That's when the habits are formed. That's when the wrong body mechanisms, metabolism starts. It results in problems much later. So I think they have a very interesting combination. There are no 15-year-olds here, but we have Yamin Yamal, playing football at the age of 17. We have a cricketer at 14. I think we want to know the future of healthcare. We should not be asking old people like me with gray hair. My daughter who's 20-something, 14-year-olds, we should ask them the future, and they have very futuristic ideas of what healthcare should be.
How many of you, by raise of hands, can tell us you would like to have a couple of those wearable sensors on your body 24/7? You can say 20% of the attendance. And youngsters, I would define it. I don't want to go into that controversy. But under 30, okay. So not too many. So that's important to understand the change of habit, because without people, without humans, smartness cannot come. So and without change, healthcare change is the biggest challenge. Change management. These you're seeing on your screen pages, more than 100 years. In India, we never use it. I can see in any hospital, we can't hear you. Pagers are still being used in a lot of hospitals in US and Western countries. They create some value. In India, we never use. Technology has brought in. So, change management is the biggest next challenge. For a new treatment technology, it's published data that it takes average 17 years from innovation to actual practice. So that how do we reduce that? We have very less time. So those kind of challenges we would like to cover. The complexity of, I will cover these and then I will take comments. That complexity, healthcare is first with complexity. Multimodal AI concepts are coming, data management and all that concepts are coming. So that complexity attracts innovation. So smartness is not going to come so soon, so easily, unless we address, at least we acknowledge these kind of challenges that we are going to face. Change management, change of habits, bringing enough this thing, removing complexity from this thing. You cannot remove. Technology can help us remove.
So
one last challenge I will bring in is missing perspectives. Engineers think differently, doctors think differently. Doctors want safety first. Engineers want to test more. How do you test on humans directly? How can you? Who takes the responsibility of that decision that was taken on a particular patient? Will engineer take a responsibility? So these questions are ethical, practical, need to be answered. A different discussion altogether. This is an example. This guy was driving a car, sees this spot. He drove for 200 miles, thinking that it's a Chinese surveillance balloon in US, while it was bird poop on his windshield. So people see things differently. And they behave differently, they act differently. So now, coming to those challenges, that's why I wanted to bring in all of these together, complexity, change management and all, and quick 30-second answers.
I won't answer this, but I just wanted to suggest something alongside techno innovation, which is inevitable. We have to engage with that. What is missing right now is a mindset for functional innovation. The example is how our emergency services are completely hampered by the traffic realities of any metro. It's just not possible in our ecosystem. And therefore, one way to deal that will be to look at it functionally, and instead of making it a rapid transport system, with sirens and, cutting through and actually endangering lives of other passengers, is to see how we can invert it and say that it will no longer be rapid transport, but it will be on-site care. That with the help of AI and technology and dashboards, the ambulance reaches the house and gives the care assisted by AI, will at least reduce the need to have sirens blaring and doing the impossible, unless of course drones come in. But drones, we don't want to talk about drones after what we saw happen 2 days ago.
My view is one of hope. I stayed back to be in India after being in the US healthcare for some time. I think US healthcare is going to be outdated for the next 20 years. They have still got faxes, they've got very archaic methods. We have an opportunity to leapfrog with the kind of work we're doing here. We are very smart people. We'll build smart hospitals, we'll build smart healthcare.
Any last comments?
Yeah, so regarding the challenges, I feel so that how do we tackle problems in healthcare? So, for example, if a startup founder is finding problems and targeting those problems, they are finding those problems not in the hospitals. So, Matt said that we need to find problems in the hospitals, find context, what is required, and create products which are seamless and they integrate into your workflow without being invasive in my work. So, I do not have to spend much time with it. So, if we create products like that, I think we'll have a lot more adoption and it will solve a lot of our problems.
Just last comment then, because the final summary would be that healthcare is disconnected. A lot of it. It's broken, whatever words we may use. We need to connect it. That's where that smartness comes in. So connected patient care, connected operations, connected clinical protocols. That's where, and without that, with technology, humans can do better than humans alone. So, last, I guess we can agree on that. Thank you.
And we have a question and answer session. We have exactly 5 minutes. Request a volunteer.
We can have question and answer. There's a lot of networking.
Okay, then you don't want question and answer?
We can go to the next session.
Okay, we'll go to the next session.
Question and answer question.
Yeah, sorry. Here's the mic that can be.
By reading Arstian report, we don't reach what we want to do. I'm telling this because I was responsible for helping Arstian to write Biotechnology of India. But that's, you need a leader. You need somebody who will vision. So I just thought of a new idea. Anybody can begin. We get 7 minutes sweetie delivery. 7 to. Why can't we have a hospital decides that you'll have hundreds of mobile motorcycle ambulance, which will reach in 5 minutes. And India's the size can train those people, right? And say they have to have their operation. I don't need MBBS doctor. I need a minimum training diploma nurse. So why don't you start that company? And that would be the right thing to do for a hospital. I just got the IKEA business, so I thought I'd share. I don't take IKEA on it. Yeah, but you can do it. Then it is the small level. This is Bharat Gera we discussed. But it needs scale up. And scale up is what rural needs.
Payment to campaign. So that's an emergency situation. After that, you will pay for it.
I think this kind of innovation will happen in India. It's already happening. And thank you for